We all know that this glass of water is essential for life, and we're told to drink 8 glasses a day to try and stay healthy. But did you know that even water can become harmful to the body if we consume too much of it in a short amount of time? This is a medical concept that applies to almost everything that we consume. The difference between something that helps us and something that harms us is often just the dose. I see a lot of genuine concern online about fluoride, and it's a valid question to ask. If fluoride can be toxic, why do dentists encourage to put so much of it in our mouth twice a day? And the answer lies in understanding the therapeutic dose. In this video, we're going to look at the safety of fluoride when it's applied topically to your teeth, why people are concerned about using fluoride, look at how much is actually absorbed when you brush, and why, when used correctly, is actually one of the safest tools we have in dentistry. To have an honest conversation about safety, we first have to look at what happens when that threshold is crossed. And when we talk about fluoride toxicity, generally we will divide it into 2 parts, acute or chronic. Acute basically means that what happens when too much is taken at one time in a short period of time, and chronic is what happens when too much is taken over a long period of time. Acute toxicity is relatively rare, especially in a household setting. It would be more common if maybe a child was to get hold of a tube of toothpaste and then eat the toothpaste. But essentially, acute toxicity would look like a lot of gastric distress and nausea, vomiting, that kind of thing. It's the body's natural response to try and expel something that it has too much of. So then there are the chronic concerns, and the most common thing that we will see is something called dental fluorosis. This happens when children's teeth that are still developing in the gums, and it's usually a result of fluoride from multiple sources. So they might be brushing their teeth with fluoride toothpaste, they might be swallowing some of that toothpaste, but also they might have fluoride in their water or fluoride from other sources as well. In mild cases, dental fluorosis will create kind of faint white lines or little white spots on the teeth, entirely cosmetic, where in more severe cases, it will start to create more of a mottling of the teeth, so they have much more of a brown appearance rather than a white appearance. There are also ongoing discussions as to the potential effects with thyroid issues or neurological development. The scientific community continues still to look into these, and they are looking for the exact threshold at which the concentration becomes toxic. For any of these toxic effects to take place, the fluoride has to be ingested, has to be absorbed systemically. So it'll have to enter through the digestive system, enter the bloodstream in order to have these toxic effects. And then this brings us to the most important question in this topic, the difference between swallowing something and applying it topically. So if there's a risk of swallowing it, why do we bother using it at all? Well, to understand that, we need to look at what's happening on a microscopic level. So if you think of your tooth like a brick wall, that wall is under constant attack. And every time that you eat sugar or carbs or anything, the bacteria that's in your mouth will produce acid. And that acid is going to pull these bricks out of your tooth enamel. And that is a process called demineralization. If too many bricks are removed from the wall, eventually that part of the wall is going to collapse, and that's what's called a cavity. Now, we do have our saliva in our mouth, and that is naturally going to try and put those bricks back into the wall, and that is a process called remineralization. But often the acid attack is too strong for your saliva to keep up. So this is where the fluoride comes in. And when fluoride is present in your mouth, not only is it going to help remineralization, it's also going to make those bricks that it puts back even stronger, because they are then made of something called fluorapatite, and it's significantly harder and it's more resistant to acid than your natural tooth structure. So when we apply fluoride at the dental office, or through toothpaste or a fluoride varnish, we aren't just cleaning our teeth, we're actually upgrading the enamel, because we are making the enamel stronger than what it was when it first erupted. And this benefit is happening right there on the surface of the tooth. It doesn't have to enter your bloodstream or go through your digestive system in order to have this effect. It just needs to touch the teeth. In pharmacology, we often talk about things like the therapeutic dose, which is how much of something you need to see the benefit from it, or the toxic dose, which is how much will cause harm. So for an adult, the therapeutic dose of fluoride is a pea-sized amount of toothpaste that contains about 0.25 milligrams of fluoride. And that's all you need to start that remineralization process that we were just talking about. So the toxic dose, or the probable toxic dose, where we'd expect to see those toxic effects start to take effect, that will require medical intervention. For an average adult, that would be around 350 milligrams of fluoride. In order to reach that toxic level of fluoride, you wouldn't just have to swallow the pea-sized amount that's on your toothbrush, but you'd actually have to eat the full tube of toothpaste, not just one tube, but 3.5 tubes of toothpaste. And nobody does that. Who is out there eating their toothpaste? So the margin of safety is enormous. Even if you were to accidentally swallow some of your toothpaste, it's not going to cause any harm. This math changes a little bit for children, of course, because they're smaller. So we recommend normally a rice grain amount of toothpaste or a smear on the toothbrush. And even still, that safety margin is enormous. Okay, so we know we shouldn't be swallowing toothpaste because that's when the most risk is going to happen of getting side effects. But I will often hear the argument then, well, it doesn't matter if I don't swallow it because it's going to get absorbed through my gums and through my cheeks. And this is a valid concern because our mouths are lined with mucous membranes and they are able to absorb certain things through them. But in order for that to be significant, the compound has to be designed to be able to be absorbed either sublingually or through the mucous membrane, and toothpaste is not. So the amount that you will actually absorb into your bloodstream is actually very, very small. And if it's not been designed to be absorbed through those membranes, then it needs a lot of time. And so bringing those two things together, we've got something that isn't designed to be absorbed this way, but also is only going to be in your mouth for 2 minutes at a time before you actually spit it out. So studies have then actually looked at this, and while there is the theoretical potential for this to happen, in reality, it's a statistically insignificant amount that is actually absorbed through the mucous membranes. The vast majority of fluoride that we intake systemically comes more from the food that we eat, the things that we drink, rather than ingesting toothpaste. So fluoride is a tool, and like any tool, whether it's a hammer, a car, paracetamol, safety is about how you use it. Safety is about how you use it. If you respect the dose and apply it topically, it remains one of the most effective ways to keep your teeth for life. When you finish brushing, spit out the excess toothpaste. This removes the bulk of the fluoride so you don't swallow it. But, and this is key, don't rinse with water immediately after. Leave that film of fluoride on your teeth so it continue to rebuild those super bricks while you go about your day. And if you find this helpful, hit that like button so YouTube knows to share this safety info with more people.